Welcome to the deep dive. Today, we're tackling a really common source of eye issues in pets. It's something you might not have heard much about, non-ulcerative
Yeah,
keratitis.
exactly. And we've got some great info pulled from non-ulcerative keratitis in animals to guide us.
Right. And our goal today is basically to make sense of it all for you.
Consider this your fast track, to understanding this whole category of eye problems, especially common in dogs and cats.
Okay.
We're going to get into what it is, how it looks different in different cases, the causes, which animals get it most, and how vets deal with it.
So, a clear overview, basically, trying to keep it understandable.
That's the plan. Thorough, but not, overly technical.
Okay, so let's start with the name. Non-ulcerative keratitis. It's a bit of a mouthful. What does it actually mean?
Well, at its core, it's inflammation of the cornea.
The cornea, that clear front part of the eye.
Exactly. But the really crucial part here is non-ulcerative. It means the inflammation doesn't make the cornea take up fluorescein stain.
Ah, that special dye vets use.
Right. And when it doesn't stain, that tells us it's a particular kind of problem, not just, say, a simple scratch or ulcer.
Okay, so it's not just a surface thing then. What's actually going on inside the eye? What's the process?
It's basically a reaction in the eye.
Hmm.
And unfortunately, it leads to the cornea getting cloudy, losing its clearness.
How does that happen?
It can be a few things. Swelling, fluid buildup or edema, inflammatory cells moving into the cornea.
Okay.
Sometimes new blood vessels start growing, and that's called vascularization. Pigment can build up too.
Yeah.
And long-term, you can get scarring,
So it's like a whole cascade of events.
pretty much. Triggered by something.
And it's mainly affecting the eyes, obviously. What about genetics? Is this something pets inherit?
Generally, no. For most of these non-ulcerative conditions in dogs and cats, we haven't found a specific genetic cause.
Ah,
Well, there's one exception, or at least a strong suspicion. Chronic superficial keratitis, or pandysis in German Shepherds. It's widely thought they have an inherited predisposition.
okay. So usually not genetic, but maybe for panis in shepherds. That's interesting.
Hmm.
Now, you said it's common in both dogs and cats. Any other big picture points before we dive into the specifics for each?
Yeah, definitely common in both.
Yeah.
And specifically thinking about that chronic superficial keratitis, again, panis, there's a strong geographical link.
Oh, yeah. How so?
It's much more common in places with high UV light exposure, high altitudes, lots of sun.
Huh. So environment plays a role, too. It's not just the dog's breed.
Exactly. It shows that interplay. A German Shepherd might have the tendency,
Hmm.
but where they live and how much sun they get could really affect whether they develop it and how bad it gets.
Okay, that makes sense. Sun exposure. Right, let's get into the dog stuff first. Our source mentions several different types. First up is chronic superficial keratitis, or panis. Sounds like a big one.
It really is. And like we said, super common in dogs. German Shepherds are sort of the classic breed for it, but sighthounds too, they have a high prevalence.
Sighthounds like greyhounds.
Yeah, greyhounds especially, and they sometimes get it even younger than shepherds do.
And when does it usually show up in dogs generally? Is there a typical age?
Well, it can start at any age, really, but the risks seems highest between, say, 3 and 6 years old.
Okay.
And there are some reports suggesting female dogs might be slightly more prone to panis.
Right. So female German shepherds, sighthounds, living in sunny spots. Definitely something to watch for. What would an owner actually see? What are the signs of panis?
Usually it affects both eyes. You'll typically see blood vessels growing out of the cornea.
Like little red lines?
Yeah, it can start like that, quite superficial. Or it can become a really dense, thick, almost fleshy-looking layer. There's also often pigment,
What kind of pigment?
usually brown or blackish. It might start on the side, the lateral part of the bottom, but in really bad cases, it can spread and cover the whole cornea.
Wow.
You might also notice changes to the third eyelid, that little membrane in the corner. It can get thicker and lose its dark edge, look kind of depigmented. And sometimes there are little white, maybe fatty or mineral-like deposits right at the leading edge of the lesion.
And if it gets really bad?
Sadly, yeah, if it's not treated, it can definitely lead to blindness.
That sounds serious. What's thought to be the actual cause of panis?
The main theory is that it's immune-mediated.
Meaning the dog's own immune system is involved?
Exactly. It's like the body's defenses get confused and start attacking the healthy cornea. And as we mentioned, high altitude and UV radiation definitely make it worse.
It seems like a lot of these chronic eye things in dogs involve the immune system somehow.
It's a recurring theme, definitely, which, might point towards future research focusing on how to modulate those immune responses better.
Makes sense. So how do vets figure out for sure it's penis?
Often, the look of it during an eye exam is pretty characteristic. A vet can often make a strong presumptive diagnosis just based on that.
But they might do other tests.
Sometimes, yeah.
Yeah.
They might do cytology, gently scraping some cells off the surface and looking under a microscope.
What are they looking for?
Specific immune cells, finding lots of lymphocytes, plasma cells, maybe mast cells. That points toward an immune process, supporting the panis diagnosis. A biopsy, a small tissue sample, is another option for confirmation, but often not needed.
Okay. And treatment. How is panis managed?
Right, well, the tough part is there's no cure. So treatment is all about control, managing the inflammation, stopping it from progressing.
So lifelong treatment then?
Often, yes. Lifelong therapy is usually needed. The mainstays are topical eye drops or ointments. Corticosteroids are key to reduce inflammation,
Steroids? Okay.
and also immunomodulating drugs. Things like cyclosporin or maybe tacrolimus or pimecrolimus. These help dial back that faulty immune response directly in the eye.
Do they use them together?
They can, yeah.
Okay.
Sometimes one or the other is enough. Sometimes a combination works best, depending on how severe it is.
What if it's really, really bad? Like the dog can't see?
In those advanced cases, surgery might be an option. Superficial keratectomy, where they remove the diseased outer layer of the cornea, or sometimes beta irradiation is used.
Does that cure it?
No, unfortunately. Even after surgery, the dog will still need the medical treatment, the eye drops, to keep the panis from coming right back. It's a big commitment for owners.
Definitely sounds like it. Okay, moving on. The next one listed for dogs is pigmentary keratitis. The name kind of gives it away. Involves pigment.
Exactly right. The main sign is brown discoloration on the cornea. It might be just a spot, or it could be more spread out, more diffuse.
And is it just the pigment?
Often not. You frequently see it along with new blood vessels growing in, or some scarring on the cornea too.
Okay. And what causes this type? Is it also immune stuff?
Usually not, no. Pigmentary keratitis is typically secondary. It's a response to some kind of chronic irritation happening to the cornea.
So something else is bothering the eye.
Precisely. Finding that underlying cause is key. It's often linked to exposure keratopathy.
You mentioned that, where the eyelids don't close right.
Yeah, logophthalmia. Especially in those brachycephalic, the flat-faced breeds, that constant exposure irritates the cornea.
What else can cause the irritation?
Tear film problems like dry eye KCS, keratoconjunctivitis sicca, and even things like trichiasis, where eyelashes or hairs rub against the eye.
So treatment involves fixing the underlying issue first.
Absolutely. That's the main goal. If there's active inflammation, topical steroids might be used short-term. If it's dry eye, then lubricants and tear stimulants like cyclosporine or tacrolimus are needed.
Does that help the pigment?
It can. Those cyclosporin etacrolimus drops sometimes help reduce the amount of pigment over time, as well as treating the dry eye.
And surgery.
Surgery to remove the pigment, like a keratectomy, is usually only considered in severe cases after you've addressed whatever was causing the irritation in the first place.
Got it. Tackle the root cause. Now, the source also pulls out something specific. Pigmentary keratopathy of pugs. Is that different?
Yes, it's generally considered a distinct condition, really specific to pugs.
Okay. How does it look?
Typically, you see brown pigment starting on the cornea near the medial side, and then it tends to spread out towards the center.
And why pugs? Any ideas?
The exact reason isn't known for sure. But because it's so strongly associated with the breed, a genetic basis is highly suspected.
So, probably inherited in pugs. How's it treated?
It's similar in some ways. Topical cyclosporine or tacrolimus might help slow it down, maybe stop the pigment from spreading further.
Can you get rid of the pigment?
Corticosteroids might temporarily make the pigment look less dense, but it doesn't usually resolve it. And even if you surgically remove it, there's a high chance it'll just come back in pugs.
Okay. So managing it, slowing it down is the main goal there.
Pretty much.
All right, next up for dogs. Nodular granulomatous episclerokeratitis. Wow, that's a name. NGE for short.
Yes, thankfully. NGE is easier. The key thing here is nodules or masses. Raised, pink, fleshy-looking growths.
Where they appear.
Usually right at the edge of the cornea where it meets the white part, the sclera, often on the outer side, the lateral limbus. But they can grow onto the cornea itself.
Both thighs.
It could be one eye or both. And certain breeds seem more prone. Cocker spaniels, collies, shelties.
Shetland sheepdogs, right. What age do these usually show up?
Any age, really, but we often see it in young to middle-aged dogs. In collies, for instance, the average age of onset is just under 4 years old.
Besides the obvious lumps, are there other signs?
Yeah, you might see some cloudiness or deposits in the cornea near the masses, maybe some swelling, edema, and new blood vessels around there too. It can progress slowly or sometimes quite quickly, and the third eyelids might look thickened as well.
And the cause of NGE? Back to the immune system.
That's the current thinking, yes. It's believed to be another immune-mediated condition. The body's immune cells are causing this reaction at the edge of the cornea.
Okay. So how do you diagnose NGE for sure?
While the appearance is often suggestive, the definitive diagnosis usually comes from a biopsy, taking a small piece of the nodule, often through a superficial keratectomy, and examining the tissue.
And treatment? Is it like penis again?
Yes, the treatment strategy is similar because it's immune-mediated. Topical corticosteroids and/or cyclosporine are the mainstays to control the inflammation.
What if that's not enough?
In more severe or resistant cases, sometimes a systemic drug, azathioprine, is added. It suppresses the immune system more broadly.
You mentioned surgery for the biopsy. Does removing the nodules help treat it?
It helps get the diagnosis, and removing the bulk of the tissue can be beneficial, but it's not a cure on its own. You still need the ongoing medical therapy to manage the underlying immune problem and stop the nodules from growing back.
Right, makes sense. Okay, last one mentioned for dogs is KCS keratoconjunctivitis sicca. We usually think of that as just dry eye, but it can cause non-ulcerative changes too.
Absolutely. The primary issue in KCS is lack of tears, right? But that chronic dryness is a major source of irritation.
Ah, linking back to the cause of pigmentary keratitis.
Exactly. So that irritation from dryness can definitely cause the cornea to develop new blood vessels, pigments, scarring, all non-ulcerative changes.
But KCS can also lead to ulcers, can it?
It can, yes. Because the surface isn't protected by a healthy tear film, it's much more vulnerable to damage and ulceration. But the chronic changes it causes are often non-ulcerative.
Which breeds get KCS most?
We see it a lot in brachycephalic breeds again. Also Cocker Spaniels, English Bulldogs, Westies, Cavalier King Charles Spaniels. Quite a few predisposed breeds.
Age, gender?
Usually middle-aged to older dogs. And like Pandias, there seems to be a female predisposition reported for KCS as well.
And what causes the dry eye itself?
It varies. Most commonly, it's immune-mediated, the immune system attacking the tear glands.
Okay.
But it can also be drug-induced, sometimes congenital, post-surgical, or even neurogenic, related to nerve damage, which usually just affects one eye.
And managing KCS?
The main treatments are topical meds like cyclosporine or tacrolimus. They do two things: help stimulate tear production and reduce that immune-mediated inflammation in the glands, plus lubricants, of course.
Are there surgical options for KCS?
Yes, if medical management isn't enough. One is parotid duct transposition, rerouting a saliva duct to the eye.
Wow, saliva instead of tears.
Yeah, it helps keep the eye moist. Another option is partially closing the eyelids surgically, a tarsorrhaphy, to reduce evaporation.
Okay, that covers the dogs pretty well. Let's switch over to cats now. First one here is eosinophilic keratitis. What does that look like in cats?
Right, so in cats, eosinophilic keratitis typically looks like a raised lesion on the cornea. It's usually vascularized, meaning blood vessels are growing in.
Okay.
And the really characteristic thing is these pinkish white infiltrates. They can look like gritty plaques on the surface.
Gritty plaques.
That's it.
Sounds distinct. One eye or both?
Usually just one eye. And interestingly, while we class it as non-ulcerative, sometimes the very edge of the lesion might pick up a tiny bit of fluorescein stain.
Which cats tend to get this? Any breeds?
It's most common in domestic shorthairs, actually. Not really a specific breed predisposition otherwise.
Age, sex.
Can happen at any age, really, except maybe tiny kittens. And there's a suggestion that neutered male cats might be slightly more prone.
Okay. What's thought to cause it?
The exact cause isn't fully nailed down. It might be some kind of hypersensitivity reaction like an allergy. But there's also a really strong association with feline herpes virus 1, FHV1.
Ah, herpes again. So how do vets diagnose this one?
The key is cytology again. Scraping cells from the cornea and finding eosinophils, a specific type of white blood cell under the microscope, is highly suggestive.
Eosinophils, hence the name.
Exactly. Biopsy is possible, but usually not needed just for diagnosis.
And how do you treat eosinophilic keratitis in cats?
Topical corticosteroids are often the first step to reduce the inflammation.
But aren't steroids risky with herpes?
They can be, yes. You have to monitor very closely for any signs of ulceration, which steroids can worsen. If herpes is suspected, topical antivirals are often used alongside the steroids.
What about other options?
Topical cyclosporine has been tried, but the results are kind of variable. For tough cases, there's a systemic drug, magistral acetate.
How well does that work?
It can be highly effective, actually, but it has potential side effects, like causing temporary diabetes, so it's used carefully and with close monitoring. Surgery isn't really curative, more for diagnosis, so medical treatment is preferred.
Okay, a few options there depending on the situation. Next, for cats. The stromal form of herpes virus keratitis. We just mentioned herpes. How is this different?
This is a more direct result of the herpes virus infection, affecting the deeper layer of the cornea, the stroma. Eosinophilic keratitis might be linked, but this is more clearly caused by FHV1.
And what does it look like?
It can be one or both eyes. You see stromal edema, so swelling within that deeper layer, cellular infiltrates too, deep blood vessels growing in, and often quite significant scarring.
Does it cause ulcers too?
Yes, this stromal form is often associated with corneal ulceration as well. And because of the deep inflammation and potential for scarring, it can definitely threaten the cat's vision.
Sounds quite serious. How do you diagnose this specific herpes form?
PCR testing is usually the best bet, testing samples from the conjunctiva or cornea for the virus's genetic material.
Is it always straightforward?
Not always. Other tests aren't as reliable. And sometimes a cat can test positive for herpes virus, but not actually have this specific condition. So you have to interpret the results in context with the clinical signs.
Right, and treatment for this stromal herpes keratitis.
It's a two-pronged approach. You need to fight the virus itself and also control the inflammation it's causing.
So, antivirals.
Yes, topical antivirals like cidofovir or trifluridine. And often systemic antivirals too, like famciclovir pills.
Except for the inflammation.
Topical non-steroidal anti-inflammatories, NSAIDs, or maybe cyclosporine eye drops can help manage the inflammation without the risks of steroids in this situation. Some vets also suggest oral L-lysine supplementation, which may help manage herpes flare-ups.
Okay, targeting both the virus and the inflammation. Last one for cats. Corneal sequestrum. That sounds odd.
It looks quite striking, actually. A sequestrum is basically a dead piece of corneal tissue that turns a dark color.
Dark-like.
Amber, brown, sometimes even jet black. It forms a plaque within the cornea, usually centrally or near the center. They vary in size and depth. Often the edges are a bit raised, and there might be some blood vessels around it. Like eosinophilic keratitis, it might pick up a tiny bit of stain right at the edge.
Which cats get these?
It's most common in the brachycephalic breeds again. Persians, Himalayans, those flat-faced cats.
Any age.
Yep, any age except maybe newborns. Usually just one eye, but can be both.
What causes this piece of cornea to die and turn black?
The exact mechanism isn't perfectly understood. It's thought to be related to chronic irritation or previous ulceration. And, surprise, surprise, there might be a link to feline herpes virus again in some cases.
Herpes seems involved in a lot of cat eye stuff.
It really does. It's a major player in feline ophthalmology.
So how do you manage a corneal sequestrum?
Well, if there's an ulcer around it, you'd use a topical antibiotic ointment. Artificial tears are good for lubrication.
What about antivirals?
If you suspect herpes is involved, yes, topical antivirals might be added. And if there's associated pain or uveitis, maybe atropine drops.
Can you just leave it?
Sometimes they can eventually slop off on their own, but it takes a long time and carries a risk of the cornea rupturing underneath.
So what's the usual approach?
The most definitive treatment is usually surgery, a superficial keratectomy to remove the dead plaque.
Is that curative?
It often is, yes. But recurrence is possible, especially if the underlying irritation isn't managed. So surgery is often the best bet, but not always the final word.
Okay, that's a lot of specific conditions. Looking back at everything for both dogs and cats, are there some general things we should keep in mind about diagnosing and treating non-ulcerative keratitis overall?
Definitely. A really key first step is distinguishing these non-ulcerative types from infectious keratitis.
Which usually does involve ulcers and infection.
Exactly. Infectious keratitis is often painful, ulcerative, and cytology might show bacteria or fungi. We also need to rule out tumors, though they're rare on the cornea itself.
And we mentioned cytology and biopsy are important tools.
Crucial for many of these, yes. Getting a look at the cells or tissue involved.
And a big point seems to be the long-term nature of many of these.
Absolutely. Especially for the immune-mediated ones in dogs like Panis and NGE, owners need to understand that treatment is usually about lifelong control, not a quick cure. Managing expectations is so important.
Good communication is key.
Vital. Also, remembering contraindications for meds, like no steroids if there's an ulcer, no atropine if there's dry eye or glaucoma, basic safety checks.
And follow-up.
Essential. Regular monitoring is needed to see if the treatment's working, adjust things if needed, and watch for complications like ongoing pain or worsening vision, potentially even blindness if things aren't controlled.
Anything else?
Oh, and for panties and dogs specifically, don't forget UV protection. Advising owners about doggy sunglasses or goggles can actually be a really helpful part of the management plan, especially in sunny areas.
Doggles. Right. That's all super helpful context. So just to wrap up our deep dive on non-ulcerative keratitis.
Yeah, the main takeaway is that it's not just one thing. It's a whole spectrum of inflammatory conditions of the cornea. The common thread is that lack of fluorescein staining.
And each type has its own quirks.
Exactly. Panthers in dogs, eosinophilic keratitis in cats, pigmentary issues, sequestra. They all have different causes, risk factors, and management strategies.
But the bottom line.
Early recognition,
Yeah.
noticing those changes, cloudiness, redness, pigment, and getting veterinary attention quickly. That's absolutely crucial for managing these often chronic conditions and giving pets the best chance of preserving their vision. It really boils down to chronic inflammation, often driven by the immune system or irritation.
Okay. And with that, maybe a final thought for you, our listener, to mull over. We've heard a lot about the immune system and environmental factors like UV light playing roles here. What kind of research do you think could really push things forward in preventing some of these common eye issues?
Yeah, and beyond the known breed predispositions, like in German Shepherds or Pugs, what more could we learn about the specific genetics that might make individual animals more susceptible? Lots to still figure out.
Definitely something to think about. Thanks for joining us for this deep dive.